Guys, I know how much you guys love watching us scrub in for procedures. By popular demand, because we did another one of these last week, we're going to do it again. We're going to do a combination of liposuction and ThermiTight. Again, so when we do our liposuction the way we do it with the tumescent technique, what happens is that the cannula going in and out causes a lot of fibrosis underneath the skin, and that actually causes the skin to contract. So oftentimes, you really don't need to do anything to contract the skin, and the skin contracts by itself. In some patients, when they have extra loose skin, or if they have skin abnormalities in terms of they've had other liposuctions before and there's contour abnormalities, it's nice to add the ThermiTight. So the ThermiTight uses radio frequency from inside out to heat up the skin from inside out, and that heat causes skin contraction. So for patients who have loose skin or we want to get rid of liposuction irregularities from previous lipos, it's a great technique to add the two as a combination. This patient that I'm doing this morning has had lipo before, and so she has some contour abnormalities, and we're going to try to address those by doing a little bit of liposuction first. Probably not going to get a lot of fat out, but then we're really going to use our ThermiTight to really tighten up the skin and melt any residual fat. So the ThermiTight procedure is really nice because it tightens up the skin. It's the most advanced way to tighten up skin, short of surgery or an abdominoplasty. And we use the ThermiTight on all skin surface areas, on the face, neck, arms, legs, and abdomen. So stay tuned. As you guys can see, we're finished tumescing. As you can see, these are cannulas that are attached to a pump, and we're pumping fluid into here. And you can see that these areas turn white and they feel firm. That's all the fluid that we've put in. And I've marked the abnormalities, the hill and valley effects already, so that's my topography is clear. So I know which areas I need to focus on to suck more fat out. So at this point, we've actually stopped giving her gas because she's fully comfortable. The area is fully numb, and we can go ahead and continue the entire procedure under local at this point. So here I'm making the entry points of where I'm going to go. Again, we use very, very small incisions. Oftentimes, I don't even have to stitch these because they're so tiny, my entry points, because we use micro cannulas to do this. So you can see how tiny our cannulas are. These cannulas are called micro cannulas because it gives you the most even results. And it does take more time to do our liposuction with micro cannulas, but the advantage is that people get a much smoother contour using micro cannulas. This machine. We've started our suction. I do my suctions manually because I feel like I can get the best results that way, and also it's a good arm workout for me, so I don't have to go to the gym today. So guys, this is the ThermiTight probe. As you can see, this probe it's insulated from here to here, but the tip, you see it's silver, and this is the area that emits radio frequency and heats up, and it's actually got a thermometer also here, so it reads the temperatures back on the screen of the device so we can see what temperatures we're at. We have it set at 70 Celsius. So we're basically cooking things from inside out. And we also have an infrared camera, as you can see here. This infrared camera reads the temperatures from the outside. and it projects it onto the screen so we can see the temperatures that we're achieving, and we don't want to go above a certain temperature. Rumor has it that this advanced infrared camera is the camera that was used to catch the Boston Marathon bomber when he was hiding, because it's a heat emitting camera and it's extremely advanced. So here we go, we're going to get started with a ThermiTight to heat up the skin from inside out. Breaks everything up. It's a better technique.